Hello folks, welcome back to another edition of International Health Problems. We are now focused on Chapter 14, Natural Disasters and Complex Humanitarian Emergencies, or CHEs, as I will call it throughout the lecture. And my name is Dr. Jody Sutherland, and I'll be providing you an overview. Once again, an important reminder to first, understand the learning objectives, as this will help you grasp the material, concepts that are important, and also studying for the examination. Natural disasters and CHEs are important causes of illness and death, and also disability. They affect large numbers of people. They can have a huge economic impact on communities and societies as well as on families, and their after effects can go on for some time, as we have witnessed with Hurricane Katrina, as far as a natural disaster that has occurred. And also when we think about complex humanitarian emergencies, we can think about the Darfur people there in Sudan, and how the impact of what's going on or has went on in that community for years and decades, again, has long-term impacts on them. Their biggest relative impact, not surprisingly, is on the poor. The poor are generally more vulnerable to the effects of some type of disaster, and overall, these complex humanitarian emergencies, or CHEs, are associated with considerably large health impacts, larger health impacts than are natural disasters. So they have a greater toll on actual health impacts of a community. We also, when we look here at the importance of these natural disasters and complex emergencies to global health, it's important that measures be taken to reduce the costs of these disasters and conflict. And we can do that by working together, working in collaboration, whether that be within a community itself or cross-nationally, trying to partner together to try to work on the most important priorities to address these disasters. You're going to come across several key terms that will be important, such as the definition of what a disaster is, any occurrence that causes damage, ecological destruction, loss of human life, or deterioration of health and health services on a scale sufficient to warrant an extraordinary response from the affected community area. So it's important for you to have an understanding of that term, as well as understanding the difference between a refugee and an internationally displaced person. When we think about a refugee, this is a person who is outside of his or her country of nationality or habitual residence, and has a well-founded fear of persecution of his or her race, religion, nationality, whatever that may be, membership in a certain political group, and is unable or unwilling to be able to garner protection in their home country or return there for fear of persecution. So this individual has left their home country and had to go into another country, again, because of some type of civil unrest or other factors that may threaten their safety. When we think about an internationally displaced person, these are people who are forced to flee or migrate and leave their homes during a disaster or complex humanitarian, but stay in the country in which they are living. So they actually stay within the country, their home country, but they have to move out of their community. And when we think about internationally displaced people, the first country that comes to mind again is Sudan, having the largest number of internationally displaced people. Next, we're going to talk about the book will take you through the characteristics of natural disasters. Natural disasters such as earthquakes and their related tsunamis, as well as droughts, famines, hurricanes, typhoons, heavy rains. These all have important health impacts in addition, again, to their direct impact on morbidity or disability and mortality. For example, when we think about heavy rains or some type of tsunami, they can have impacts on the water supply and sanitation systems, as well as the health services and the availability of food. So we can see here the impacts and the toll that can take on a community. We know that the number of disasters, natural disasters, are increasing, and this is being contributed to global warming. We are also seeing that a larger number of individuals are being affected, causing more and more economic losses, but causing proportionally fewer deaths. So surprisingly, even though we're seeing more individuals are affected and it's causing more economic losses, proportionally there are fewer deaths. And this probably lends itself to the fact that we are trying to be better prepared to address these natural disasters. So alert systems are improving, and other facilitators that are helping individuals relocate before this natural disaster occurs. As we stated, though, the relative biggest impact is on the poor in these low and middle income countries. And again, this causes disproportionate damage to the health systems and other infrastructure within these communities as they try to absorb, again, this natural disaster. These Next, we want to talk about the characteristics of complex humanitarian emergencies. These often, as we stated, go on for long periods of time, unlike natural disasters, which may, although be lengthy, may be shorter in term. Sometimes groups that are fighting will not allow humanitarian assistance to be provided. We've seen that in the case of Sudan. The combatants often target the civilians. And we also see during these times systematic abuse of human rights as well as food shortages. Not surprisingly, breakdown of publicly supported health systems, and then unhealthy living circumstances for the individuals in these refugee camps. These complex humanitarian emergencies have been increasingly linked to civil conflict, and they take lives directly through war-related trauma, as well as lead to the destruction, again, of the infrastructure of these communities. And when we think about at-risk populations, women are especially vulnerable to complex humanitarian emergencies, particularly with regards to sexual violence against females. The next section will talk about the health burden of natural disasters. Again, direct and indirect effects that it can have on a community or a society, and these depend upon the type of disaster. Some effects are short-term, such as death, although that's a huge impact on a community. Others are very long-lasting, such as psychosocial problems and distress. PTSD, for example. We're seeing a rise in that because of these natural disasters and complex humanitarian emergencies. And when we think about natural disasters, the very old and the very young and sick are the most vulnerable within these natural disasters because they are going to take longer to evacuate. There needs to be a specific plan of action to protect them. So when we think about public health preparedness, we really want to focus on the young, the very old, and then those who are unwell. The next section will talk about the health effects of these CHEs. They are large when we think about the health effects and often underestimated because, again, if a society is in civil unrest and conflict, public health workers cannot get in there and collect surveillance data to try to assess what's the health impacts, what's going on in this community. So we have to try to estimate. Between 320 and 420,000 are killed each year as a direct result of CHEs. That's huge. Very shocking. Oftentimes we see malnutrition, again, lack of safe water. Food shortages, breakdown of these health services that can lead, again, to greater prevalence of illness, disability, as well as death. Next, we can see here the causes of death in these CHEs. In the emergency phase of a CHE, when large numbers of displaced persons are coming into camps, there are a number of health risks that have to be addressed. Among the most important are just basic communicable diseases such as diarrhea, measles, malaria, as well as pneumonia. Malnutrition is also of exceptional importance during these times, and then cholera epidemics are generally on the rise and kill a large number of people quickly, again, because of the impact that these complex humanitarian emergencies can have on water supplies and sanitation systems. And also, when we think about where these internally displaced individuals go, or even refugees, they may go out into desert places, for example, or places where they don't have access to proper water sources. Populations affected are, again, generally poor, so we see SES, or socioeconomic status, has an impact, and again, may suffer from protein, energy, malnutrition in a camp. So gaining access to vital nutrients is very important when we think about trying to address these complex humanitarian emergencies and address the leading causes of death. We also see that here when we think about mental health, social and psychological shocks due to changes in the way of living, the loss of your livelihood, damaged social networks, and physical and mental harm may result in the occurrence of a mental health issue, whether that be PTSD or anxiety disorder. Children and adults, again, often suffer from high rates of depression and PTSD as a result of these CHEs. And it's important to help people rebuild their lives and social networks as quickly as possible so that they can resume some type of normalcy. Next, we want to look at how can we address the health effects of natural disasters. Countries at risk can take a number of different measures to mitigate vulnerability to damage from these natural disasters, again, through disaster preparedness planning, building seawalls and levees, again, to ward off whether it be hurricane or a tsunami, and requiring, for example, that buildings have some type of code that makes them in areas that are earthquake-prone areas so that they are earthquake-proof. And Japan does a very good job at addressing that. We can also conduct assessment and surveillance, carry out assessments of the displaced populations to understand their characteristics and what's going on with them. Again, creating a system for disease surveillance and for diseases that cause epidemics among displaced persons. Again, thinking about malaria or cholera. So those are important things we can do, again, assessment-wise. We can also make sure that we assess the health situations of these individuals very early on, and that the urgent cases be handled immediately. So you would want to prioritize treatment. You want to care for those that have experienced trauma, other injured people who are in need of some type of early treatment. We also see that it's important to establish continuous disease surveillance. So although you go in there immediately following one of these natural disasters and you assess what diseases are prevalent, within a week or two, you could start to see the manifestation of another disease. So we want to have continued disease surveillance in these communities, and then make sure that we provide individuals with food, water, and shelter. Also, it's important to note that to be most helpful, external assistance, so when we bring in assistance from outside communities or countries, we want to make sure that there's communication between all of these different external partners so that we are collaborating and reducing redundancy in services. be based on a cooperative relationship, that we don't have any ulterior motive for wanting to try to help. Be evidence-based and transparent, so make sure that what we're doing is based on the science, the leading science of how can we address this natural disaster, what's the most effective way. Make sure you involve the affected communities in the discussion. Oftentimes, these efforts exclude the affected community themselves, so bringing them into the conversation is very important. And then just generally, disaster preparedness plans are very helpful for reducing the impact of some type of natural disaster. And then lastly, we want to look at addressing the health effects of complex humanitarian emergencies. The health situation of a CHE needs to be addressed very quickly and then continuously. Again, we don't want to just do one assessment and be done. We want to be doing this over and over again. Early attention in dealing with these large number of displaced people must focus on, again, the environment, particularly providing shelter, water, and food. And then the next steps in the focus on the prevention and treatment of different disease outbreaks, again, looking at measles, malaria, pneumonia, and also malnutrition. We want to also make sure that within this environment there is adequate space and facilities for personal hygiene, again, to reduce transmission of these communicable diseases. Again, this making sure that there's adequate clean drinking water as well as for cooking and bathing. And then an adequate number of toilets. And we would also want to segregate these by sex, again, to reduce sexual violence on women. And then when we think about shelter, these need to be culturally appropriate and what individuals are accustomed to. When we think about food, these individuals would need at least 2,100 kilocalories of energy per day for an adult. Vitamin A should be given to all children. And then nutritional supplements to children who may need it. Again, when we think about disease control during these CHEs, we want to make sure that all children from 6 to 15 are vaccinated for measles. Proper management of diarrhea, if we see that when we go and assess our population. Appropriate diagnosis as well as treatment for malaria. And then again, health education and hygiene promotion. So public health can really make an impact there. And then lastly, you will move into the section on future challenges. After you read about specific case studies. So here we want to look at the future challenges. Again, reducing the negative health impact. How can we minimize the negative health impact, whether that be death, whether that be disability, or whether that, and when we think about disability, not just thinking about injuries to the body, but also the mental health domain, psychosocial elements of health impacts. Developing and using standard approaches, so a transnational maybe approach to try to address some of these issues, and then responding with the most cost-effective approach is going to be vital. As you finish up reading this chapter, make sure again that you look at the study questions, as these will help you again link yourself back to the objectives and prepare for the examination.